One of the top things that gets asked about all-on-4 dental implants is how much do they cost? And there's actually a lot of factors that get played into that. We have Dr. Hendricks here who's going to tell us the top 10 cost influencers on all-on-4 dental implants.
So the first factor is geographic location. You know, if you're in New York City or Miami, Chicago, some of these places that maybe have higher cost of living, you're gonna have a higher price in any dental treatment. Places like, Nebraska, Utah, there's a different cost of living associated with it. The second factor in that geographic location is that depending on how many doctors there are in the area that do this procedure, that'll affect, supply demand, basic business concept, right? If supply is high, then the price drops. And in certain places, there's lots of dentists. Geographically, if there's lots of dentists, then you're gonna have a lower price in any dental treatment also. It can literally be a difference of $20,000 per arch. So the price difference could vary anywhere from $20,000 to $40,000 if you're doing top and bottom, just based off the geography. So that's why at Dream Dental, a majority of our patients are coming from out of state. Salt Lake City is great because it has a lower cost of living. Sometimes when people are searching for places to go that are the cheapest, that are willing to travel to these places, people will look at Mexico, South America. And oftentimes that's why people will come here to Utah, is because if you look at the price, even though it's always gonna be more than people want, right? The price is always a tough one. But in Utah, we have, I believe, just as high or even higher standards. In Dream Dental, we have a lot higher standard, and yet the price, just give you an idea, my buddy in Ohio, his price, he gets 25 to 30% more than what we get here in Utah. And so that's why people leave those areas and come to Utah and places like this to get work done. So one of the biggest factors that affects costs, I think, aside from geography, really it's either a two-doctor approach or a single doctor approach. And what that means is that traditionally there's been a surgeon, a periodontist or oral surgeon that does the surgery, and then that's considered phase one. And then phase two is basically having a general doctor, either a prosthodontist or a general dentist, do the restorative work or building the final device. And so this is probably one of the biggest things that affects the price, because when you have two doctors, it's going to increase the fee. And so why would you even consider doing this? A lot of people say that if you go to a surgeon, that you're going to get a better outcome. Maybe an oral surgeon, a periodontist of some sort, and then go have the teeth made by someone else. But this is where you end up paying a lot more money. And the reason why is because you have the fees from the oral surgeon and the fees from the general doctor. You add those together, it's always going to be higher. I can't tell you how many people have told me that, where they had surgery done by one doctor and then another doctor puts the crown on, and then when things go wrong, who's responsible for it? That's always the problem. And the patient always feels frustrated when no one wants to take responsibility. And if you have one guy that takes responsibility for it, there's still fees attached to it. Now, if you take that scenario, and let me just tell you a different scenario, and this is a scenario that's going to be a lot less expensive, and that is if you have one doctor that does from start to finish the whole procedure. This is a doctor that has been trained in doing dental implants, who also has the training in making the devices. And if I was to go even one step further, in our office, we actually have the lab technicians here in our office too. That's like the dream team, when you could have one doctor that actually owns the lab and so is controlling all those forces. The reason why I like this is because now, as you do more and more cases, you get to see the work that you do. So when I do a case, I can't just do the surgery and then send them off to someone and say, good luck. No, when I put implants in, I know that's just one portion of what we're doing. Yes, we do have other doctors that work in my office. I do primarily the surgery. However, I take full responsibility for the whole device. And so if you have one office versus two offices that are doing this, if one office is capable of going from start to finish, and they have the experience, because this is one you got to be careful with, right? Because if you do it once a year, and you have all this training, but you only do it once a year, do you think you're going to be very good at it? I learned how to play the guitar right after I got out of high school, and just long enough to totally woo my wife. Once I wooed my wife, I put the guitar away, the job was done, And now 15 years later, I pull out that guitar and I can't play very well at all, right? And so unless you're playing all the time, you just don't keep those skills. And so if you're doing this once a month, you might be okay to take easy cases. But if you have one doctor that's doing this every single day, that's a doctor that's going to be very, very good. And if he's really, really good also, that means that he can lower the price also. Within the one doctor solution, you have different tiers of experience. And so you're going to pay less if you have one doctor do it. But within that tier, okay, now we have one office, that's better than having two. But if we have one office and then on top of that you have lots of experience, this can go one of two ways. The more experience you have, like for example, for me, I've done so many surgeries that surgery, I can do it in probably a third of the time that most doctors do. You know, and so when you've done it over and over and over again, you do get better at it. And when you get better at something, you get more efficient, you can actually lower your price too, right? It takes you less time.
Yeah, that makes sense.
So that's why I feel like I'm able to lower my price to be more competitive, or at least competitive enough. I'm definitely not the cheapest, but I'm far from the most expensive. That's why people come from all over the world to be done here. All dentists have a good heart, they mean to do well, and you develop this really great relationship with your dentist. It might seem natural to have him do this really big procedure on you too, but it always goes back to how much experience that person has. Even if you have the biggest heart in the world, it doesn't compensate for good old-fashioned experience. The more often you do something over and over again, it becomes natural. There's things that I do in surgery all the time that no one has ever taught me. Nothing I've ever read in a book. It's just because I've done it and seen it and felt it so many different times that I do things unconsciously because it's given me success. And so even though you might have an amazing general dentist that has done great crowns and fillings and great root canals, there's only a few doctors that can do that level of quality of care in general dentistry and can also spend the time to get the education and the experience in doing full mouth implant dentistry for All-on-4. I have a few friends, they ask me this all the time, Bri, I want to get into All-on-4 dental implants, what do you suggest I do? And I tell them, you know, you really do have to spend the time to learn it properly. There's some guys that will go to like a 2-day course and then all of a sudden they go home and they advertise as if they've done this lots of times. It's happened to us around here. Yeah, it is scary. And the sad thing is these poor patients won't know the problems they have in their mouth for years to come.
Yeah,
and that's what makes me really sad, is because if you don't do the procedure as if you're gonna have to take care of this patient for the rest of their life, when you take on a patient and you take on their case, you know you have to take care of them. Now contrast that with someone like me who's done a residency, you know, solely in implants, and then out of school and out of this residency, I've traveled all over the world. I mean, all over the world to be mentored by the very best doctors. Doctors that have, these are the guys that wrote the textbooks. These are the pioneers. I believe there's something to be said for having a pedigree. I believe that if you get closest to the source, you're getting the purest form of the education. Maybe this doctor was taught by this doctor, who was taught by that doctor. I'll just go to the doctor who started the whole thing. Doctors that have very little experience typically are going to lower their price in order to convince the patients to come in. Doctors that have a ton of experience and they know the true gamut, the fact that they're going to be taking care of these patients for the rest of their lives, they're going to buffer enough into the fee that's going to justify all the intended work that could take place throughout the next decades of life. And so it's a huge factor. When I first started, I lowered my price more, but I was very transparent with the patients that I worked with, saying, you know, you're my first case. But I think that's the thing, is asking that question to the doctor is, Doc, how many times have you done this? And if he says, oh, lots of times, then you might want to ask the question, can I see the pictures? Can I see some testimonials? And I think that if they ask it and they act a little funny about it, then it might tell you something too.
Yeah.
I'm very transparent about how many cases I've done, but there are really people behind each one of them, and I've learned from everyone too.
Yeah.
The types of implants used and the number of implants used, how does that affect the price? And so let me explain this to you. So not every case is the same. Depending on the patient's bone density, depending on the patient's level of infection in their mouth, depending on the skeletal features in the patient's mouth, it requires certain types of implants, and there are certain implants that cost more. There are premium brand implants, and we have mid-level, and there's lower brand implants. Problem is a lot of doctors, they don't disclose this to their patients. And that's why I take a lot of time with our patients and I discuss these issues, but we'll custom order implant sizes. There's sometimes we have to put implants up into the zygoma bone, right? These implants are 3 or 4 times more expensive than a regular implant.
I've noticed some procedures you do all-on-6 instead of all-on-4. Is that because of bone density issues?
Yes.
And would that be more costly to have to pay for 6?
So for most doctors that know they're going to place 6 implants, that would cost more. And so with Dream Dental, we typically will plan on placing 4 implants. But if we have to do a 5th or a 6th implant, we do that in surgery, and we actually don't make them pay additional fees for it. But most doctors, if they do plan 6 implants from the beginning, that will affect the price. It could be upward of 5 or 10 grand in price per arch. And so the type of implants, the number of implants used, and all this is patient specific, right? That's the hard thing, is your mouth isn't the same as mine, nor is it the same as the guy behind the camera. Each patient has their own needs, and so it's really kind of difficult to say, well, how many implants do I need, or what type of implants are you going to use? That's why we have to see you. We got to take a 3D image. We got to see how your lips move. We got to see what your skeletal parameters are, and if you take all this into account, then it's easier to get a precise number.
So when it comes to implants and different materials, is that something that the patient gets to choose, or where does that come from? Do you have to order things in? How does that all work?
So at the consultation, that's where we make a plan. We pick out the implants, we pick out the number of implants, the type of implants, and then more importantly, what type of materials we're going to use to actually make the teeth themselves, right? Because you have types of implants, but then there's devices or bridges that we build, and there's different materials that we use for that also. Most dentists have to send their lab work outside of their office. Many doctors will make a mistake of thinking that a good lab that deals with crowns would be a great lab that does all-on-4, and it's completely not accurate. You actually want to use a lab that is very experienced with all-on-4 implant bridges, and sometimes they'll send them to labs that aren't very experienced and they don't use really great materials. There are people out there that actually will send their stuff even to China. They'll send them outside of the United States where there's the parameters, FDA approval is not even taken into consideration. And so that's the scary thing, is that you may think that your doctor is using really good materials, but at the end of the day, what they're really using is something that looks good, but underneath the surface is kind of like what's in the middle. You can have something that looks beautiful and it goes in the mouth, but here's the problem: 3 or 4 years from now, it's failing. It's worn out, things are breaking. And so you really do need to, every lab I've ever worked with, before I had my own lab here at Dream Dental, every lab I worked with, I toured the facility, I looked at what materials they were using. It was never enough just to say, yeah, we use zirconia or we use titanium. No, okay, I want to know the exact type of zirconia you're using. Where are you buying it from? I want to know the type of titanium. There's different grades of titanium. These are questions that most people aren't going to ask. But when it comes to the fact of why is one guy able to lower his price so much more? Well, the biggest factor in this is lab costs. And so when you have a really low price, you have to ask the question, okay, doc, that sounds like a really fair price, but can you tell me where you're going to send that lab work? And is it here in the United States? And if it's here in the United States, can you show me the website of the company you're using? Can I see cases that they post? What's the warranty on this? A really great lab is going to have some sort of warranty that goes behind the bridge or device.
If they're shipping it all the way to China, isn't that going to take a long time?
Yes.
Because they have to build it and everything?
Yeah. So I get so worked up on this, but you're right. There's the thing is, when you choose an office based off of solely just price, and they choose a lab that's outside of the United States or outside of the state they're working in, now the timeline changes dramatically. And they may say, okay, yeah, it's gonna be 6 months, 7 months, but guess what? It might end up being more like 8, 9, 10 months, even a year to get it done. Every time you ship it off, it could be 2 to 4 weeks before you get it back. And so yeah, it factors into it. Here's the thing that's cool about Dream Dental is that we have a lab here. And that's probably one of the things I love most about my job is I can control as many factors as possible. And our lab is called Elevated Lab. It's owned by Dream Dental, and but we have 4 technicians that work in there, and then we have a number of doctors that communicate with them, me being the primary doctor. But every morning I like to come in and look at cases and do quality control on them. Every single material that's being brought into my office, I know where it's coming from. It's coming from somewhere in America, maybe Germany, somewhere that we know has the very best. I'm very transparent with my patients, all the products and materials that I use. I never have anything to hide because we only use the best. And because we use the best and we have great equipment, our milling, we have 2 milling machines, we have a printer, all this affects it because now we can do things that would normally take 8 to 10 months. We do this now in 5 days. The number one reason people come and see me is cosmetics, right? I want nice teeth, okay? I just want to look good, okay? Second thing is I want to be able to chew and eat my food. The third thing is I'm in pain. I'm miserable. This denture is driving me nuts. It's moving all over the place, or my teeth are bugging me. The fourth thing is I am just so tired of spending money on dentistry. And because every time I spend $1,000 on a crown, a year later it comes off, and now I'm going to put an implant in, and I'm just tired of having to spend. So depending on what 4 reasons people give me, that really dictates which device I'm going to suggest. Because the reality is if someone tells me they just want a beautiful smile, they don't need to go for the Mercedes. But if I say, well, okay, does it matter if you're going to have to redo this in about 3 to 5 years? Let's use an example, the titanium. The titanium device, which most doctors do use out there, it basically has a titanium substructure. Like for example, this is an example of titanium, and we're going to put this on the screen. But what's interesting about this is that if someone tells me they want to look beautiful, this is going to give them a beautiful smile, hands down. If they tell me they want to be out of pain, this is going to be out of pain. This is very comfortable. They tell me that they want this to last long term. Now that becomes a problem. Long term, we have to define what that means. A device like this, it looks beautiful. The bar is long term, but the teeth, the thing that actually people are going to see, those do wear down. And even the best teeth, like the teeth that we use in our lab when we do these, they're gorgeous and they're the highest quality. They're the best. I mean, we spend a lot of money on these teeth, but even the best teeth, they're going to wear down. So, you know, Jen, you're how old?
33.
So at 33 years old, if you knew that you had to spend a sizable amount of money on this, but every 3 to 5 years you had to spend an additional $2,500 to put new teeth on to make it look good.
No.
Probably not, right?
I'd rather just spend the money and get it over with.
Yes. But if you're 75 years old and you think that you might live for another 5 to 10 years, maybe it doesn't make sense to go into the Mercedes zirconia.
So our 93-year-old patient that we did surgery on yesterday, which was awesome. Perfect. He seemed like the sweetest little old man.
Yes.
Did he go for the one that one then? That's
actually a perfect example. Willard is one of my grandpa's good friends. He's 93 years old.
He's so cute.
He's the oldest patient I've done All-on-4 on. But his biggest thing is I want to be able to chew and eat. And we know that he's not going to be here on this earth for long. And so what we did is we actually built him an acrylic device, which is similar to this titanium, okay? And it basically is something that we don't have to worry about it lasting long-term like the zirconia. And so yes, that's a perfect example. So a titanium is something that works better for patients that, you know, they're older in age. They're okay with a little fix here and there, but it's not like they have to live in this device for 40 or 50 years. I think the thing that is most often missed is most patients, they don't know anything about this continuum. You can travel from here to your house in a lot of different ways, right? You could go in a Mercedes, or you could literally crawl. Either way, you get there, right? Would you agree? Like, there are people that would crawl. I mean, there are people in the world that actually do this, right? They make pilgrimages and they will actually travel long distance on their knees. But the difference between the two, both are traveling. One is very convenient. One, you have a lot of certainty that nothing is going to break down. When a Mercedes, you're traveling in class. It's the best of the best. On your knees, you still get there, but you're scraped up, you're tired, your back's probably hurting. It takes forever to get there, probably takes a lot of practice, but you both move in the same direction. In the same way, it's how it is with these different devices. my advice would be to patients out there trying to decide what's the best place to go and trying to factor cost into it, is you have to ask the right questions. So once you ask the doctor his experience, once you ask the doctor where he's sending his lab work, now you need to ask him what types of devices do you offer? And then go back to that one question, what type of warranties are you going to give me? Because if you're going to go on the continuum of the cheaper device, the acrylic, and then as you work up into some of these resin bars, and you go into Trilor and pectin, and then titanium, and now we're on to zirconia. As you go through that continuum, you're going to have a lot more warranties up here because the device is super strong. Down here, you're going to probably have, in our office, our titanium I don't have warranties on because I know the titanium itself is warranted for 5 years. But the teeth themselves, that's something that I can't warranty because depending on how you treat it, if you're grinding your teeth and you're clenching down, you're all stressed out all the time, there's no doubt you're going to wear those a lot faster. And so that's why we don't offer warranties on those besides the bar itself. The other factor that really plays into this is the types of devices are being made by these labs and being directed by these doctors. And so there are lots within the All-on-4 family. There are a lot of different materials. If I was to start at the cheapest and work our way up, we have an all acrylic device that has no substructure in it besides acrylic. Sometimes doctors will do this for like 15 grand per arch, okay? I've even seen it as low as like $12,000 to $13,000 per arch. But there's no substructure, there's nothing strong, meaning that the device is gonna break for sure, it's a matter of how much time. And so some doctors will call this a long-term temporary in a sense. But there's no promise. It's basically, it looks beautiful, but it will break and you'll have to pay for those over and over again until you get a strong substructure. You have an all acrylic, basically temporary all-on-4 device. The next up from that might be some type of resin bar to go underneath the teeth. And in our office, we've done these in the past. Like there's a couple materials one's called Trinia. It's like a fiberglass resin. And again, that would be cheaper than say the next one up from that, which would be a Trilor or a pectin substructure, okay? And then above that would be a titanium substructure. And if we were to go one more above that, now we go into a zirconia substructure. So everything below zirconia is going to be a combination of materials that are basically being glued together, okay? And the reason why these are cheaper is because what it takes to mill these out, to actually cut these out and design these is cheaper. So the literally physical product is cheaper, the expertise, the machines used for these are cheaper. But the funny thing is this, is that you think because you have different materials that you'd have a different looking device. They all can look beautiful. The reason why you choose to go for a zirconia, or like a Mercedes in a sense, is that you're looking for not only beauty, but you're looking also for function. You're looking for long-term investment, what's gonna last the longest. On the other end, if you're looking at like the all acrylic, which is like a temporary that's placed at surgery, that one's gonna look beautiful, but the second you bite into a nice big steak, it's gonna break. So you're basically getting into that as more of a cosmetic concern. So the biggest question I always ask my patients is this: why are you here? And the funny thing is that patients look at me like I'm crazy. Because they'll have like really bad teeth, right? And they'll look at me and go like, boy, you are a horrible dentist. I don't know if you've heard me say this, but I go, I know it seems obvious, but tell me more. Because just the fact that you have bad teeth, tell me how that affects your life. What do you hate about your teeth?
So the patients, they get to pick their material, they get to pick the whiteness of their teeth. What about surgery-wise? Is there anything that they get to choose with that?
Yeah, so one of the big factors that plays into cost is the level of anesthesia. Okay, so there's really kind of 3 different tiers here. And this will dramatically affect the cost of your all-on-4 treatment. On the base level, you basically have local anesthesia. That's what you typically go when you go to the dentist. It means you just get numbed up. It's just numbing and you're awake 100% for the procedure. That would be the base. The next level up from that is going to be IV sedation. IV sedation, or sometimes I'll do oral sedation. I would lump that into the same amount because usually you're going to pay anywhere from $300 or $400 per hour to have that sedation take place. When you do sedation, you're having to put an IV inside the person, and you're actually pushing medications to make it so that you are basically in a place emotionally where you're very stable and relaxed. Most people even feel like they're kind of falling in and out of sleep, but it's still considered a conscious sedation. We have to hook up to a lot of machines. We run an IV, we have a drip line, and basically it takes a good hour of preparation before the surgery, during the surgery, because we're trying to manage the sedation. Usually this is done by the operating dentist too. But yeah, it takes more time for the doctor to do the procedure, therefore it's why it's going to cost you more.
And who, if you just do the general shots, who does that? Could it just be like a hygienist, or?
Typically you're just going to be numbed up by the doctor or hygienist, and then literally you're awake the whole time. The problem with that is that you are feeling all the pressure. I mean, you may not feel pain, but you're feeling like the weight of like someone pushing on you. And that's what's really difficult. People will tell me they're really anxious and they're really uncomfortable simply because they just feel the amount of pressure to take a tooth out and then to drill a hole into the bone. And it's a lot of pressure on the face, and if you already have anxiety, that's really tough for most patients. And so most of my patients don't do local anesthesia. With IV sedation, actually Dream Dental, we don't do IV sedation on our All-on-4 patients anymore either. And the reason why is because these surgeries can be sometimes 2 to 3, sometimes 4 hours long. And I made the decision a few months back, almost a year back, where I wanted to solely focus on the surgery. And so we actually elect for the third option, which is general anesthesia. And general anesthesia, that's where we actually bring in a third person, a medical anesthesiologist in our case, and he completely intubates and breathes for the patient. He literally is keeping you 100% asleep the whole time. And what that does for the patient is 100% peace of mind knowing going into the surgery they're not going to be awake for it. And there's also peace of mind for the doctor too. I mean, I've done it both ways. I used to do IV sedation a ton, and I think I'm very good at it. But there is a level of intensity, and there's a level of, if you're doing this every day, because you really want an experienced doctor, it becomes something that can be stressful. Mm-hmm. And so I like to be very chilled, and I don't want any more stress while I'm doing surgery. And so like I said, we do, again, the three options are local anesthesia, IV sedation, and then there's general anesthesia. And the general anesthesia is the one I highly recommend. You're going to pay, anywhere from $400 to probably $700 per hour, depending on what state you're in. Again, going back to the supply and demand, in our office or with our anesthesiologist, we're really lucky because we do so much of it. We've negotiated a fee down to $400 per hour.
Wow. And
so that's a big factor. And you have a medical anesthesiologist. If you were to do the same procedure up in the hospital with the anesthesiologist, you would be looking at almost 3 times, 4 times more than that. So even though it's not so cheap, when you're doing a big case like this, I think I would want to be asleep.
I would, so. For sure.
So what are some of the risk factors that would make it so a doctor adds a little bit more of a price to your case fee? The first one would probably be something like where you're a smoker, and smokers typically will have a harder time healing, and you have a higher risk of implant failure. And so doctors typically will buffer in a little bit more of a price in there if they think that they may have to do revisions. And even if you have to pay for some of these revisions, a revision would be something like replacing an implant, doing an extra graft, dealing with an infection that developed post-surgery. These are things that would, overall, as a doctor, we'd look at it and we kind of say, okay, how much time is this going to cost me? What's the likelihood of success? Where could this case go wrong? If we look at all this, sometimes a doctor will increase not sometimes, we always will adjust the price. If it's an easy case with less risk factors, then the price would be lower. In my office, someone that comes in, let's start here. What are the biggest risk factors that make me want to think about raising the price? Smoking. A patient that's super unhealthy, maybe a diabetic. Someone that's maybe a diabetic but uncontrolled. okay, not taking their blood sugar regularly, someone that has a history of a lack of hygiene, right? So if they've never brushed their teeth ever in their life, patients that have heart conditions, when we look at it overall, what's the chance this patient's going to heal? What's the chance I'm gonna have to go back and do this procedure twice? We look at all these different risk factors that's gonna make our time in the case longer. It's gonna increase the likelihood of having to add more materials, more devices, the treatment time period. What's the chances, how difficult is it gonna be to treat them? Some patients can't lay back. I've dealt with a lot of patients that don't, that because of their skeletal issues, they can't lay back very well because they kind of obstruct, and or they've had surgery on their neck. Some of these things might play a factor. For me, those are minimal things because I can deal with that, and I love helping people, especially patients that maybe are harder on other doctors. We really do take the harder cases here, and we really try not to raise our fees any more than we have to. That's really reasonable. But in some places, there'll be doctors that will increase the fee dramatically just for small, relatively, we say small, but for the doctor, they can be big risk factors.
These people with these risk factors, don't you have to do some sort of special things for them?
Yes.
Is that why it costs so much more?
You're absolutely right. So when I have someone that has more risk factors, then I'm going to perform a surgery differently. And when I perform that surgery differently, I may do different techniques. For example, if I look at their CT and I notice they have very porous bone, meaning that the bone is not that hard, a lack of density in the bone, meaning that when I put an implant in, it's not likely going to go in really tight. That means that as I look at the case, there's a high likelihood that I'm going to maybe put more implants in, or that I might have to order special implants that might have zygoma implants. Anytime I have to do an extra technique, there's some patients that I have to do sinus grafting on. So depending on the anatomy of your sinus, we may have to do a full sinus lift to get it out of the way, which really does increase a lot of time in the surgery. If on a regular all-on-4, Dr. Hendricks is going to take probably about 2 hours. Dr. X, who's a normal doctor that doesn't do this often, he may take 4 hours. If I do a sinus lift, it's going to take me an extra half an hour. If Dr. X does a sinus lift, it's going to take him maybe an hour and a half, 2 hours. And so we will adjust our fees to accommodate that time. And that's why some doctors will raise their fees quite a bit if they have to do extra techniques. And that's why some patients go, gosh, why is it so expensive, more expensive for this? Well, a lot of times it's because if I was doing myself, I would have to adjust a little bit more time into it because it's going to take me more time. To be able to get the right smile with the lips, sometimes we do what's called a lip repositioning surgery, where literally we will loosen the muscles so the patient doesn't pull up quite as high. And that's something that I've done many times before to help someone with a really gummy smile. One of the things that most doctors don't look at, but the good doctors do, is not just how much bone you have, but how much gum tissue you have. And so that's why a doctor that has more experience might charge a little bit more, because he's seeing that there's going to have to be more surgery done to make sure the outcome lasts long term. So just for example, like keratinized tissue or gum tissue, the leathery tissue that goes around your teeth. If you don't have a lot of that, the chance or risk that implants could have problems go up. And so when I look in the mouth and I see that there's very little gum tissue that's nice and leathery, then that's something that I might have to do a couple extra procedures intraoperatively the day of the main surgery, and then also little revisions down the road. And so again, it's one of those things, like a really great doctor that sees this is going to add that in because he knows as far as time. Again, at Dream Dental, I rarely I don't increase the price hardly at all for those small things. But if it's going to take me an hour and a half, 2 hours, then I will add a little bit more in.
That makes sense. So say I wanted this procedure done and I wanted it done fast. You're saying that there's temporaries I have to be put in for a few months?
Yes.
Is there a way to skip that process?
You know what? There is, and that's what makes Dream Dental so unique. And this might be our 10th and probably one of the biggest factors in price for other offices. And that is that how long is this gonna take to go from start, meaning the day of surgery, to your final device? For most offices that don't do this often, it's gonna be somewhere between 6 months and a year, okay? Even though they say it's gonna be 6 months, because I've been there a long time ago when I first started, we had our best, we were so optimistic, but because you're sending your lab work out and back, getting modifications, it would take more time.
Yeah, you have no control over it at that point because it's in someone else's hands, so you can't really guarantee a time.
Yes. And that's one of the reasons, again, that I invested so much into our lab here so that we can create a product that not only is beautiful, it lasts forever, it feels good, it looks great, but with that whole process, this whole process can happen in a week compared to like 6 months to a year. And it seems almost like crazy, right, that can happen. If you are able to have your own lab with the right equipment, with the right talent, literally you can go through this whole process in a week. And that's huge. The product will always be awesome, but the process, what the experience is like for the patient, that was the part that really bugged me. You know, patients loved me at the beginning, but at the end they were just kind of exhausted. They were tired. They wanted to be sooner and faster.
So when you say a week, are you guys open 7 days a week, or how does that work? Does it overlap the 7 days over 2 weeks, or?
No, no. It's basically 7 consecutive days. So on Monday we do our surgeries. On Fridays we seat our devices. On that following Monday we're going to check the bite, and then our patients can fly home.
Nice.
And so literally it happens all within 1 week. Everyone always wants to know real numbers. And I think that the last video that we did, we got a good response, but we did get some feedback saying, okay, yeah, that's all great, doctor, but can you be more specific? Why don't you throw some numbers out? On the low end, if you are someone that is in a denture, that has low risk factors, that's willing to travel, if you look at all the 10 factors we looked at, your cost per arch could be around 15 grand. Why would it be more expensive? In areas where the cost of living is super high, you have a very high cosmetic demand, meaning that your teeth are already look pretty good, but you want them even better, so you want lots of you want porcelain on top of the zirconia, and you want to have gums that are specifically shaded to match, and you want to see it multiple times. Lots of risk factors, high smile line, maybe you need zygoma implants. This is someone where the cost of the All-on-4 dental implants could start at anywhere from $27,000 to $35,000, maybe even $40,000. You basically have a range is somewhere between 15 at the lowest and up to, I would say, 35 to 40 at the highest. I would say an average price for Dream Dental per arch, meaning for just the top or just the bottom, would be somewhere between 20 and 22. I'd say it was a pretty standard price. It could go as little as 15 if you pick a titanium supported device, and it could be upward of 25 to 27 if you decide to go with zirconia. Now you have a reason of why it's so hard to give pricing. I feel bad all the time because people come in and all my newest employees are just like, Doc, why can't we give price? But after you watch this video and you can see just how complicated it is, you can see why doctors are really reserved to give pricing.
If you have any more questions, or if you're interested in this procedure yourself, you can book a free consultation with us that includes the free 3D CT scan, which you can see how important they are now. And you can contact us by calling us or filling out the form on our website, and we'll reach out to you.